Kristyn Burtt for LifeScript.com. Dr. Kathy Magliato is one of the few female cardiothoracic surgeons in the world, and she's made it her mission to spread the word about making heart health a priority. She's teaming up with Joe and Jennifer Montana for a new campaign, and she's got some great tips for reducing the risk for heart disease. We know that heart disease is the #1 killer of both men and women, but we know more about breast cancer awareness.
Wow.
What is it with heart health?
What is it with heart health? Yeah. You know, you bring up a great point, and I want to just mention that it's not just the #1 killer of men and women in the U.S., but it's the #1 killer worldwide. You know, I think what the big myth about heart disease is that people think they're immune from it, right? We have no vaccine for heart disease. And so really it's a disease of all people. And what's up with heart disease is the fact that, you know, we need to build a better awareness campaign for heart disease, which is what this movement is that we're working on now, this initiative, Break Away from Heart Disease. And we learned that from breast cancer, right? We learned this great awareness about, you know, breast cancer. Women understand what the symptoms are, they do their self-exams, they run out and get their mammogram. But when was the last time a woman got her heart health checked?
Well, I'm going to ask right away because I'm sitting here thinking, I'm like, I know exactly when I'm supposed to get my mammogram. When am I supposed to get, you know, cholesterol checked?
In 15 minutes.
Do it.
You need your cholesterol checked. But no, I get that. And, you know, you're right. When am I supposed to get my numbers checked? You know, we start to see heart disease as we age, right? So age is one of the risk factors for heart disease that we can't control. So the minute you're starting, you know, to approach that age of around 50, 55, that for women is sort of that perimenopausal time, that's the time we really want to start seeing you and looking at your numbers.
A lot of people know that there's a family history, and it still doesn't register.
So really knowing that family history is critical, right? Because there are risk factors for heart disease, 2 of which we can do nothing about. One of them Joe talked about, which is family history. We can't do anything about our family history. The other one we discussed just now, which was age. Other than those 2, all the other risk factors for heart disease we can do something about. And that's why, to Jennifer's point, heart disease is 80% preventable. This isn't cancer, this is heart disease. So why is a disease that's 80% preventable still an epidemic? Why is a preventable disease our #1 killer?
Yeah, let's talk about the things we can control. We talked a little bit about diet.
You and I are control freaks. What can we control today?
I mean, I'm the girl that loves the bag of potato chips. So there, you know.
I'm that same way. I am not one that loves sweets, but for me it's salty, crunchy. Oh,
delicious.
I hear you.
Diet would be one of them. Yes. Obviously, salt intake.
Diet. Yep.
I know Joe was talking about red meat, lowering that. Are there some other things we can control on the diet side?
Yeah, healthy. We're looking at a sort of a heart health diet, a Mediterranean diet, where a lot of the fats we like to see you on are more the monounsaturated and polyunsaturated fats as opposed to the saturated fats. We want you to avoid at all costs trans fats, which are found in our processed foods that we love, okay, the chips and the, sorry.
I know.
I'm very good about not doing it, but it's hard, I know.
It's hard.
The other thing we want to see you doing is what we know to be a healthy diet, which is vegetables and fruits and whole grains and lean meats, and that's sort of the easier part. But the biggest kick for some people is really the exercise component. And I get asked all the time, you know, Kathy, what's the one thing that I could do to prevent heart disease? And I always tell people, obviously if you're a smoker, quit smoking. But if you're not a smoker, the biggest thing really is weight loss. And what's the fundamentals of weight loss? Diet, which we just talked about, and exercise, which is what this campaign's about.
What type of exercise? Because for some people, you know, getting out and jogging 5 miles every day is no big deal.
Right.
For other people, trying to even get in 10,000 steps of walking is a huge. It's hard.
It's hard.
It's hard.
We can make it very simple for people. What the American Heart Association recommends is 30 minutes of exercise most days of the week. So 3-4 days a week, we want to see some form of exercise. But again, it doesn't mean that you have to do some high intensity heart rate of 150 for 30 minutes. You could simply do what you recommended just now, which is walking, which is, you know, 10,000 steps. It's about that. And so the exercise doesn't have to be intense. It just has to be done. So sedentary lifestyle is one of the risk factors for heart disease that we can do something about. And in particular, cycling is a terrific exercise, whether it's indoor cycling or outdoor cycling.
Men and women have different symptoms when it comes to heart attacks. And I think we all watch TV and we just see someone going, you know, they crush their left side, and that's not always the way it goes.
And yet, you know, that's interesting that you bring that up, because the number one way that women often present is with no symptoms at all, but simply dying, dropping dead from heart disease. So sudden cardiac death is actually one of the most common symptoms that we see with women, which is terrible. I love, by the way, the fact that Joe knew the symptoms of heart disease in women. So I love the men who support campaigns for heart disease in women because, again, his wife is just as much at risk for heart disease as he is, given her risk factors. And so for women, the symptoms can be much more subtle. And in fact, 50% of women get no chest pain whatsoever. So just what you said, what we see on TV, the clutching of the chest and the distended neck veins and the dropping to the ground, we don't often see that dramatic element in women. Oftentimes we see fatigue, shortness of breath, jaw pain, sometimes arm pain, but half of women get no chest pain whatsoever. So waiting for that symptom to happen is not how you should be looking for heart disease.
And then for men, chest pain is more common, isn't it?
Yes, substernal chest pain, which is chest pain beneath the breastbone, is much more common. But again, they also get indigestion, jaw pain, especially chest pain combined with shortness of breath and sweating, what we call diaphoresis. That is also very, very common in men again as well.
It's amazing to think about because we all endure stress in one way or another in our daily lives. So
we all do.
We all do.
Yeah.
Gotta calm down.
Calm yourself.
I also want to talk about the fact that you are one of the few female cardiothoracic surgeons in the world. This is an incredible accomplishment.
Thank you.
And it really plays into, I also think, heart health awareness, because we talk about the differences between men and women. We focus so much more on the male side, but it's really important on the female side.
Yeah, and that's why I really have chosen to work for so long with, I've been working with the American Heart Association for almost a decade. And I've really dedicated my life to heart disease in women. And I think a lot of it was being a female heart surgeon made me sort of a little bit stand out in the crowd. In the history of heart surgery, which dates back to 1948, there's only been about 270 or so women that have ever taken and passed their boards in cardiothoracic surgery, just like a lawyer would pass a bar exam. And I felt like I had a unique platform as a woman surgeon to speak to women about heart disease. And that's why I use that platform to do what I do as a volunteer for the American Heart Association.
And this campaign, you're able to donate. Can you tell us how people can trigger donations for the American Heart Association?
Yeah. And it brings up a great point about donations. So the foundation upon which we have built the American Heart Association has to do with three elements. One is awareness, which is what this campaign is about. The second is research. We do a tremendous amount of research. We've actually funded 13 Nobel Prize winners as part of our research efforts at the AHA. And the last one is education, also again part of this campaign. But the research component, that costs money. And that's where the donations for this campaign will help. And you can trigger a donation very simply by going onto the website, which is breakawayfromheartdisease.com, and simply uploading a picture of you doing some type of heart healthy activity, particularly cycling. And if you do that, it automatically triggers a $1 donation to the American Heart Association to fund that research. And I'm very, very grateful to the people who have already stepped up and done that. So very simple, and it doesn't even money out of the pockets of the people that are coming to that website and doing it. So I hope to see a lot of donations through the website.